Hi, this is Dr. Kevin M. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Please remember that these videos do not replace visits to your physician's office. We're happy to see you here. If you have questions or concerns, at area code 775-359-7111. We cannot help you over the internet or the telephone. That's bad medical care, and attempts to do so are really unethical. So please don't call with questions, don't email us with questions. But if you'd like to be seen, we're happy to see you here. We would like to continue our ongoing series of first aid for parents. And so today we're going to talk about bee stings. With the advent of spring and summer, we're starting to see more and more bee envenomations, and so this is kind of important to talk about. Now, before we go any further, we kind of want to differentiate between bee stings and stings from other stinging bee-like animals, such as hornets, wasps, and yellow jackets, because there is a bit of a difference. Hornets, wasps, and yellow jackets, their stinger is designed to allow them to repeatedly sting you, or to sting repeatedly over the course of their lifespan. Consequently, after a sting from one of them, there's nothing left behind in the skin. However, with bees, true bees, their stinger is barbed. It's designed for a one-time use. When they sting you, they disembowel themselves and, in a sense, commit suicide, but the stinger is often left behind in the skin. The first step of handling a bee envenomation is to remove the stinger from the skin. Now, you need to be careful when you do this. Up at the top of the stinger is a pulsating sac. That sac is the poison sac. If you squeeze it, you squeeze poison into the skin. That, of course, is not a good thing. So how do you remove it? The easiest way to remove it is with a pair of tweezers, grasping the stinger from below the poison sac. If that's not available, you can use a credit card to scrape the stinger off, or a knife, preferably a dull knife, to scrape the stinger off. Don't cut the skin when you do that. Once you've removed any stinger that may be present, whether this is bee or yellow jacket, hornet, wasp, the next thing is to look quickly for signs of anaphylaxis. If you have somebody who's known anaphylactic to bee stings or other types of animals of that sort, then they should have an epinephrine pen available to them, and you should immediately inject them with epinephrine, after which they should be taken immediately to the emergency room. And if you don't have readily available transportation, then emergency services should be contacted for emergency ambulance transport. I don't want to talk too much about signs and symptoms of anaphylaxis. That's outside of the scope of this discussion. If you think you're having an anaphylactic reaction, see a physician in the emergency room now. For patients who are not anaphylactic, the region that's stung will swell up. It tends to be a local injection site reaction that can swell from anything the size of a quarter to the entire limb swelling. All of that is uncomfortable. None of that is dangerous. First thing to do is to wash the wound with soap and water so that you don't get an infection from it. And then you can apply some meat tenderizer mixed into a paste to the skin. That often helps to break down the poison, which is a protein of sorts. Ice helps with the swelling. Tylenol or Motrin definitely helps with the swelling. If the pain is severe and you're not able to move the limb at all, then it's worth seeing a physician. Sometimes oral steroids need to be given as well. Rarely do things like Benadryl or Claritin or Zyrtec help. This is not really an allergy so much as it is a reaction to the poison that's been injected in you. It's okay to try these things, but don't be too shocked or disappointed if they don't work. Normally the swelling is better in a day or so, but if the whole limb is swollen up, that may take a couple of days to get better, so patience is going to be important. Single bee stings, single wasp, single hornet, single yellow jacket stings are rarely fatal unless you're allergic. However, if you receive hundreds of these all at once, bad things can happen. So if you've been attacked by a hive or a swarm, again, seek medical attention. If you're having difficulty breathing, your lips are swelling, your eyes are swelling shut, your tongue is swelling, your tongue, chin, lips, mouth, throat are tingling or itching, you need to be seen in the emergency room right away. I hope that this has been of help to discuss just basic first aid of a basic, simple, uncomplicated, unanaphylactic, or unallergic bee sting. Again, if you have allergies, this discussion, that is outside of the scope of this discussion, and this discussion is not intended to address that issue. Please don't try to utilize it as such, because this is way too basic for patients with allergies. If you have allergies, discuss that with your allergist. This is Dr. Kevin M. Windisch. If we can be of help here, our phone number is 775-359-7111. We'll see you next time.